Live and in charge.
Yes. What's up, buddy? Hey.
Zoom just doesn't want us to be great. And I'm about to find a whole nother professional setup.
You know, between Zoom and my Wi-Fi, it's just been an interesting time.
I'm so happy that you were able to join us. I'm actually pulling up the video so that way I can pin our post. Let's see. Oh, people are joining us. This is amazing.
Great. Yay.
I'm so excited.
Hey, people.
All right.
Yeah, so I warned Dee Dee that my Wi-Fi is janky, so I'll freeze probably quite a bit.
You got to love a doctor that says that their Wi-Fi is janky.
Is janky.
Who are you even?
Look, I use words and I'm like, is that a real word to other people? When I say things like, what did I say today? Poo-poo. I was like,
what is that?
Right.
That's some New Orleans shit?
That's some New Orleans shit, yeah, for real. So you knew it though. You knew it was
some New Orleans shit.
So you knew it was. I don't
said,
know if other people, but you know, we poo-poo it. We disregard it. Disregard is probably the proper.
You just poo-pooed it.
Yes. Disregard is probably the magical word that I'm looking for, but I prefer poo-poo.
I feel like whatever you want to say today is a word. So that's what we're gonna poo-poo around. That's what we intend to do.
Yes. So now you understand how to drink this water and say poo-poo.
I'm so happy that you were able to join us. Disclaimer, technology is going to be what it's going to be. So I don't want people talking trash about me because I'm 11 minutes late. So it was a lot better than it was yesterday. Number one.
We were here.
We are here. Number two, I want to get to a place in life where my co-admin, Liz Joyce, doesn't say to me, we got to get you a new computer because we're tired of you looking like somebody auntie on a Zoom. Like,
you know what? So let me just tell you a disclaimer that I bought a new computer, but I have a Air.
And you still look like somebody auntie.
Yeah, exactly. So I think it doesn't, it's not the best camera. So,
okay.
So
no, they're talking about like processors and stuff like that. This is all stuff I don't understand, but I'm learning because this is all learning curves. You know,
I picked my computer because it was not heavy and it was rose gold.
All the important things, Joia. All the important things.
I was in the Mac store like, oh, this is a pretty color.
Ain't this pretty? And so I want to welcome you to the full set.
Yes.
This is a show where we just let Black folks come on from all different walks of life and talk their stuff. I mean, because at the end of the day, we're going to be sitting here watching white people, tigers, kings, bears, oh my, like, you know. And so I just figured, why can't we curate a space, which I've been trying to do since 2017, but I have my own blockage probably.
Okay.
I'm glad that you're here. I want to read your bio.
Oh, it's kind of long. Really? No, please don't do that. It's too much.
That's why I said not really, because I feel like people need to know you like I know you.
Oh, okay.
I don't know you through your bio. I was going to say your Bible.
I don't know if everybody's ready for all of that.
You deserve the Bible that you got in your bio. Like, you know? But I know you as such an amazing. I just want to tell people how we first met.
Yes, I like that. That's a good one.
Okay. So I was minding my Black ass business, as I usually do. I think I met you on accident, but maybe it was on purpose. I got invited after General Assembly with the UUA, right? It wasn't General Assembly. It was some Black thing that we did, and it was like Black UUs Matter. We went to that, and it was a convening. And fucking around with Reverend Sekou. That's how this happened.
Exactly. I blame Sekou for so many things. He married me and my husband, so I'm always like, yo, Sekou is a big part of I love Reverend Sekou. I don't know if he's listening or watching. I try to keep that brother close at heart, but he brings me amazing people like you. So I'm happy that he did that. And I love him too.
This is what I want to tell people about you. So this man said to us, y'all hungry? And when I say yes, I thought we was gonna go to like Niao's or something like that and eat some like red beans and rice or whatever. We pull up to a house. And I said, what is we making a stop? You know? And then we go to your house, and it wasn't your house. I think it was your sister.
No, it was my house.
It was your house. Okay. And so we went in, and your sister was at the table. She's an attorney.
Yeah.
And I was like, we're not going to get along. This is a super respectable home. The home is beautiful. There are murals on the wall. The dishes are in the right place. I don't want to be here. And your sister said to Egypt, come here, little girl.
That would be my sister, yes. I wonder if she's wild. I should text her, be like, are you watching my
And y'all were just so accommodating and just welcoming and warm. And it was like a family party you were having. I think one of your children.
Yes, it was my daughter's birthday or something. She had crawfish, we had people.
I was like,
I remember
these people?
It was like a baby. And yes, and I remember the day. We have pictures from the event.
And Egypt was sitting in your sister's lap, like,
yes.
No issues. I'm like, wow, my baby is calm today. Okay.
Yeah, she was amazing as always. I'm texting my sister, like, check us out on Facebook Live.
That's so funny. And so I just remembered, thinking that, like, okay, these were some really amazing people, and I left it at that. But then you and I ran into each other again. With the same group of people. We had a women's lunch or whatever it was at the house, what I call the starting over house, right?
Yes.
Like it was just a lot going on.
It was a lot going on.
It was. And so we came to the house and it was like a nice break because it actually gave me a lot of people know I don't cook on purpose. And so I took it upon myself to cook that entire lunch,
wow.
and just
I remember that.
Y'all. You remember now? It was like, it was one day they came, Frequency, the poet, and just like, I'm gonna tag one day too. So, and it was just a good experience. And it made me feel like y'all are so welcoming in New Orleans, and you shared some of your experiences with us. And you're such a humble person. You was like, I'm not here to talk about me. I'm here to talk about us. Like, I was like, she's different.
It's too much.
I couldn't believe you was a doctor because, not only are you a Black woman who wears natural hair, but you out here like, what is we talking about? I'm a regular person,
Yeah.
So
I think at the core of that whole thing is that I really do love that I get to meet amazing people like you. Like, that's the truth. I love that I get to get new communities, and especially people who are like really trying to do something to help Black people. I'm always about that life.
Your sister just joined the live. She must have got your text.
I was like, look, come on in. Hey, Jonna.
Hi, Jonna. So I want to talk to you about all the things, and I'm actually overwhelmed with where to start because you and I didn't rehearse this. No, so I'm going to dig in. I got no problem digging in. Yeah. When I first contacted you about I contact everybody I love because I want other people to love them the way that I love y'all. And I was like, Dr. Joia, you got to come. You got to come to Albany because these people don't know what the hell they're doing. And I said, and I want you to talk about the Medicaid redesign and the way that it actually affects marginalized people. Yeah. And he was like, Medicaid redesign? Black people? Got it. Like, you know what I'm saying? But then I had a falling out with some of the organizers and I just felt like defeated. Like, I was like, I wouldn't want to bring you here into all this mess. Like, you know what I'm saying? But you know what? I give you your accolades and your flowers now while you're here. Like, not that I'm trying to be up your ass, but you look for me. Like, you know what I'm saying? You like, I'm going to be in Albany.
Right. I'm like, and that's the thing about the whole, I love being, especially with people who actually, like I said, love and want to be doing the work. And so if I'm in a city, I'm like, who do I know here? I know Didi. I need to contact Didi because I know that it's going to be, that I'm going to hear smart things and then we're going to have some fun and it's going to be good stuff. And so you make me feel welcome when I'm there. So I appreciate it.
Of course, there's always going to be a party when I'm around. So, and then, like you and I talked, you were doing a lot of work and you still do a lot of work. You live in DC, right? But you're doing a lot of lobbying because Albany, coincidentally, is the actual capital of New York State, not New York City, and so you're here often. And I remember reaching out to you and I was like, I don't know what to do, Joia. Should I take my MPH or my NSW? And you were like, what the fuck?
I did not say that. I might have done it.
There was a lot of silence though on the end. A lot of silence.
Look, if Donna's still on the line, she knows I do silence.
Yes. She said, Donna said, I have arrived. You're welcome. I can't believe that's your sister. I just love her so much. And I'm actually glad to see you, Jonna.
Yeah.
So I wanted to talk to you about some of the things I wanted to bring you here for.
Yeah. Okay.
Right around that time, Medicaid redesign, we talk about Medicare for all. No one knows what that means, really. It's okay. I don't know what it means. I just know that I pay a lot of money for healthcare. And I think about countries that have universal healthcare and how we're not anywhere near those countries. And I think about how we're in the midst of COVID-19 and people are not getting cared for. People are getting selectively treated, right? The whole CNN just released a report on hydrochloroquine and how it came out, and it may not have been the best thing, but who are the guinea pigs for this? It's always going to be cash poor people who are like, give me anything to feel better, whereas people who have money have people around them to say, actually, we've seen the studies on this, so you can't give this to our folks. Like, you know what I'm saying? And so like, how do we advocate for ourselves in the midst of everyone having their own personal agenda? And I say it even about the Medicaid redesign people, because at the end of the day, the hospitals have a vested interest. Don't get me started. I worked in healthcare. Seriously, I worked for a number one. That's all I'll say. I worked for the number one rated healthcare plan in the United States for 4 years. I worked on the provider services side, so I would talk to doctors all the time, and I know how to code switch you.
We all know how to do it. I just decide how much I want to do at this point in my life. I'm leaning into my, the end of life where I'm like, boy, I'm going to start like really being that Black woman who just says shit because I can.
Do you get in trouble for it, even at your position?
I do, definitely do. Yes. I've learned that I have to figure out for me what keeps me sane. So healthcare redesign. So let's start with Medicare for all, because that
come on, talk to us. Tell us about it, because I don't know. I don't know that much. This annoys me.
So Medicare, the reason they pick that phrase is because people who have Medicare love it, right? So if you pick a word that people love, it gets you traction. So that's all. So it's just
people going.
It gets the people going, right? So it's like saying Michael Jordan for all, right? Like it's just a thing like that, huh?
Everybody want to be like Mike.
Okay. Everybody want to be like Mike. So everybody wants Medicare for all. Like it's hard, even for people who are very conservative, they love their Medicare. They want their Medicare. So it's hard to fight that phrase. It's hard to fight and say, no, you shouldn't have Medicare. Whereas Medicaid comes with baggage. The language comes with baggage. The language comes with people thinking about it's only for certain people and it's bad, right? But in a state like where you were in Massachusetts, Medicaid, which is covered by states, is actually better than Medicare. So when I go to Massachusetts, my health people are like, why y'all keep wanting Medicare? We get more benefit from Medicaid in Massachusetts. So
Medicaid in Massachusetts was the shit. I had a whole baby on the state back. Thank you. Talk about me. Ratchet us and look at my baby thriving.
Medicaid in Massachusetts pays for infertility.
It does, and it's definitely a person's choice, right? Whether to choose to procreate or not. Like fuck eugenics, right? Like, you know what I'm saying? It's our personal choice.
So trust me, Medicare is not paying for anybody's fertility.
So what is Medicare Part D? Because I hear about this a lot as some things. Like I'm like, we're gonna ask you all the questions, Doc. I'm asking people to ask you questions right now as we speak. And if you got a question, leave it in the comment section.
So look, these are like the healthcare attorney. Jonna should answer that one. No, but so A and B were hospital, in hospital, out of hospital, and then they added D for pharmaceutical, for drugs. So they're just different programs that cover. So one is hospital, one's outpatient, and one's like your medications. So it's all still piecemeal. So you mentioned other countries. So we're the only country that's high income. There are 37 countries in the world that are high income. And we're the only one that doesn't provide health care for everybody. So the phrase Medicare for all is just it's a way to get people engaged with the idea that everyone should have health.
So it really should be called, do you think it should be called universal health care? Do you think that white people would be adherent to it? So that's the
problem. So here's the messaging problem, right? Because when it's stuff that we can get to, ain't nobody trying to vote for that. So it's hard for white people. It's hard for anybody who is marginalizing another group. So like if you don't like certain religions or if you don't like certain genders, you can't really fight Medicare, right? Because a lot of those folks are using Medicare. But if we said universal health care, they're like, oh, you won't give it to those people?
Right.
But that's really the goal. All those other countries, what they say is health is a right, right? So once you start with health is a right, then you figure out how to get there. So it could be through insurance companies, it could be through a public plan, it could be whatever. We haven't even decided that we believe every person in the United States should be healthy.
Right. Only a few states actually have. So that's why you have a state like Massachusetts, right? Yeah. Like, and I'm hoping you agree with me because I'm just about to pull all my mass knowledge out my ass, right?
Yes.
That's why you have a state like Massachusetts.
Health in Massachusetts is amazing. So go ahead, keep going.
Okay, so you have Massachusetts, right? Which is one of 13 states that can amend the U.S. Constitution. And so a lot of people look to Massachusetts as founding fathers, Pilgrim Rock, all that shit, whatever. So most likely whenever Massachusetts takes on a juncture and people are out here voting blue, right? They're going to follow what it is. People think that it's California, that it's Florida even, but when it comes to progressiveness, and I hate the word progressive, I hate the word liberal, I hate it all. But when it comes to progressiveness, I do have to give it to Massachusetts because Mitt Romney and all his problematic shit just did.
He created Obamacare. He created Obamacare. Like we built Obamacare off of Romney Care. It's the same stuff. So that's why it's also deeply problematic in so many places, right? Because it was
white at first. And we try to be like, well, let's fix it for the Black folk and the cash poor folk. Because, some white people are going to be like, but what about us?
Right.
So Obamacare
is essentially Romney Care. And so what so many of the provisions and so many of the things that we need for like universal healthcare, you don't really get from that legislation. So that's the next iteration. And I do think we can learn a lot from what happened in Massachusetts and what they've done since Obamacare.
Right.
In these last 4 years.
Not a damn thing. I know.
I
almost lost my life and my baby giving birth in Massachusetts. I know. And so your sister just asked me to ask you a question.
Oh,
you're gonna roll right into it. Right off the back of me saying I almost lost my 3-year-old for almost 3 days. It was 78 hours in total in labor. No one was listening to me. The daddy and doctor to say to me, "Can I talk to you? Can we clear the room?" And she came to me and was like, "I want to try something. I'm not saying the hospital is at fault, but I want to try something. Do you know that I had been on Pitocin for 2.5 days, had an epidural, and my water had not broken?" That when they did the original test, it showed that I had some amniotic fluid in my vaginal canal, but my water had not broken. So of course Egypt wasn't coming. Of course, but I was already dilated because I was on the Pitocin. So she didn't want to say, the white people before me made a mistake, but she was like, "Can I try something?" And she stuck this like long wooden handled thing.
An amnio hook, yes.
What is it called?
An amnio hook.
An amnio hook inside of my vagina and up my cervix.
It's like a sewing hook.
She was like, "You're gonna hate me, but I feel like we're gonna be friends after this," is what she said. And sure enough, she was right. She was the first person to listen to me because up until that point that she and I actually had a real conversation, everyone was treating me like the angry Black woman because I was like, there's a problem here. And if you don't get it, then I need to be transferred to another facility. They wasn't expecting me. So I feel bad that there are so many Black moms who I won't say are undereducated, but I will say that the hospital sure isn't taking it upon themselves to make sure that moms feel comfortable. They look down on you if you bring a doula or a midwife because you're a Black woman. You know what I'm saying? And so
you give an example of what we're trying, the core and the hard part of trying to fix what you just outlined is that it's soft skills. It's not like a concrete thing of like, how do you measure a blood pressure or how do you measure somebody's urine output? So those are things healthcare knows how to do, but how do you measure the fact that some people just don't listen to patients? And when you don't listen to a patient, that is just as bad as not taking their blood pressure or not paying attention to the urine output. So like the assumption that we know better and that we could just tell you what to do when you have no input, that's how medicine is taught and that's how it's practiced. So they just saw you as aggravating them. Like, you're just telling us, and we know better. We already see documented in the chart that your water bag is broken. So we already know. So we don't
And
have
it
to ask
wasn't.
you.
She stuck that hook inside of me.
Right.
I never experienced like a pain, first of all. And then all the water from my amniotic fluid came out of my vagina, like onto the bed. And I was so mad because now I'm wet. You know what I'm saying? Like, so this whole time I was forced into labor when all they had to do was like check to see if, and I don't know how you check. I don't know if it's, I know they have the, what is it? The ultrasound, right? It can measure the fluid, right? And so,
yeah. I mean, it's that you are, all I'm saying is, yes, you are outlining a very, it happens way too frequently that people don't listen. They just see what's in the chart before them and they go, oh, her water bag's already broken. So that's not what it is. And they're assuming that you're still in labor for all these other reasons without
they were
actually.
like, Black women don't have babies the natural, whatever the natural way means. Cause I feel like however you parent is however you parent. I hate that conversation. About like, if you didn't have it natural, if you didn't have it, you know, and they were trying to give me a C-section and, you know, I already have a pacemaker. So I wasn't really, for me, I said surgery is not an option because I'm Black. They're not going to care if I die and then my baby is okay. Like, you know what I'm saying? Like, and so I fought it. They were going to call CPS or Children's Services on me because I was like, if my baby's heart, like I felt like I was very informed about my decisions. So my baby's heartbeat is fine. I was like, if you're saying that there's no drop in activity over the past, 6 hours, I was like, I think that we can wait it out until we figure it out. And then that's when the doctors, a Black woman, said to me, and we talk.
Right.
And, I said, okay, we're gonna talk. And then sure enough, Egypt was born 6 hours later. Like, like, why is it, Johnny was asking, and that's also my question. Why do Black moms and babies die more in childbirth? Even someone as famous and with money like Serena Williams, a dark-skinned, masculine, feminine person is like, no, we don't really hear your pain. Why is that?
I mean, but we have a long history of devaluing and not listening to women, especially Black women. And so so we die because no one's listening. No one's respecting our choices. No one's valuing what we're saying. And so we're more likely to die. And I know that my colleagues who are fellow OBGYNs get really frustrated when I say that because they hear me fussing or complaining about them. And they're saying, I'm doing the best I can. It's a lot going on. And all of us are doing the best we can. But clearly the data is showing us that even we are not listening. Like for you, imagine if that woman had not come in and said, sis, let me just talk to you, right? Like if she continued, we have this joke, and if you're Black and you work in healthcare, you're in the matrix, right? Because you're in this space that's highly racist. People are constantly saying things about patients, making nicknames for patients, talking about obesity, talking about people not being married. Like all these things are happening, and you either decide to participate in that, ignore it, or fight it.
It's like the locker room talk for medical professionals. Oh, I think you might have muted yourself or your Yankee Wi-Fi happened to us. You gotta come back, Joia. We love you way too much. Okay, there it goes.
Here come back. So I told you, I warned you. I told you it's a mess. Yeah, but the ability for us to be honest about the fact, we have data now that shows that Black women, when they ask for a C-section, they're less likely to, for pain medicine. Right. They won't get it in the same timely manner that a white person would. And that's documented. Like, so so many of the things we had to like prove by like studies, and we keep having more and more studies that our pain is not treated. Right. That our
Washington Post released an article about that as well, that they had done a study and 53% of medical professionals, from the administrative assistants all the way to the physicians, said that they believe that Black patients have a higher tolerance for pain. And if folks want to see that article, I'll post it in the links too. So,
and when it comes from history, it comes from our textbook. So our OBGYN was founded by J. Marion Sims, and he was a slave owner who traveled around the United States with 3 Black women, Lucy, Betsy, and Anarcha, who were enslaved, and he would do surgeries on them without any anesthesia. He would cut fistulas and he would repair them in rooms where people, medical students could watch. And he would not provide any anesthesia. Roby wants to say hi.
Okay. Hi, Roby. Hi, Boo. I hate when parents apologize. I'm so glad you didn't do that. I'd be on Zoom calls all day and they'd be like, I'm so sorry.
I don't know. He just wants to say hi. Let him say hi so we can move. So he traveled around the world, and when he could do surgeries on these women without anesthesia, he said the reason he could is because Black women didn't feel pain. And he wrote this in textbooks. And that idea translated for a long time. So imagine that, like the idea that he couldn't get a white woman to go through this surgery, but the black women who were enslaved would. He decided it was because of their pain tolerance. And the
that
truth
perception
is,
be wild as hell.
He missed the whole thing about when you are enslaved, right. Your tolerance is a lot different than when you are right. not enslaved.
Right.
And so to make that be about biology or anatomy or skin thickness was also an excuse for being racist.
Right.
Yeah.
You know, that's that old trope that white people didn't know any better. And how could I be responsible? And it's like, well, your forefathers were irresponsible and sometimes purposeful. And so like you standing here right now enacting the same sort of microaggressions seems wildly familiar, you know?
Right, exactly. Right. Yeah. And so, I mean, truthfully, there's so many places like we are stoic. We don't yell in labor. We are not more likely. That doesn't mean we're not feeling the pain, but we have been socialized to know that if we are too loud or if we're too much or if we do too much, that we will be harmed by that. So people perceive because we're not loud or yelling or cussing them out or doing anything dramatic, oh, we must not be in pain, or if we're not crying. So I had many patients who would say, I want an epidural. And if they could say it calmly, the anesthesiologist would say, oh, no, you don't really need it yet. No, just because I'm calm. That's years of Black woman practice, baby. I can do all kind of stuff.
You want me to get ignorant? We could go to level. The distance.
Yeah. So it's a real thing. Like we have really socialized ourselves to try to tone ourselves down. Mm-hmm. And then that, unfortunately, we can't win. If we're loud, they don't want to come in the room and help us. If we're quiet, they don't think we need help. Like what exactly do I need to do for you to see me as fully human and valuable and that my needs need to be met? That's all I'm asking, America.
There's a Black doula here that says, and they're racist ass degrees from these racist ass institutions too. It just compounded racism, you know? I want to talk to you about fibroids because that was the thing I had called you on. Like, I love the fact that you're so like, even though I respect the fact that you have boundaries because you're your own person, you out here trap sizing around the world. Like you are the
trap sizing. I like it.
You are the director of the National Birth Equity. Like, you know what I'm saying? Like you are all the things. You are a Black woman extraordinaire. And we out here and I'm like, Joia, I just been diagnosed with fibroids. What the fuck am I supposed to do? Can you come and talk to me about fibroids, but really talk to everybody else? And this was like a year ago, remember? Yeah. And so like, let's talk fibroids. Like when I posted that I had fibroids and that was a cause for so much period pain. Yeah. A lot of Black women joined, or I would say even Black folks that have uteruses, joined in and was like, at the end of the day, I'm living with it. Or, you know, I was diagnosed with it, but I really don't do much with it. What's the deal with Black women and fibroids?
Well, so the truth is, it is 70% of white women have them too. So I don't want us to start like making this only be about Black women, because I think we get problematized around things when other people do not, right? So like,
why are white women so comfortable with their fibroids?
Let's talk about that, right? I'm on that page now. My life is like, what? Let's talk about how everybody got them, but magically it becomes a Black woman thing. I don't understand. Anyway, so that's
I love you so much.
So we are less likely to get ours evaluated and treated. We have lower rates of hysterectomy. We have lower rates of getting all the medications and the things that people need. So we suffer with them more. Yes, we are not treated for them more because once again, our pain is not valued, right? So it is, so their muscles, their tumors is a doctor word for growth. It doesn't mean cancer. So
that's what I was going to ask you. Is it cancerous?
No. So they're non-cancerous tumors. So they're growths that are muscle tissue that grows inside of your uterus, and they cause you to have bleeding. And so we are like, we're like, by the time you're in your 40s, 80% of Black women have them and 70% of white women. So it's a very common thing to have. We have not done a good job of like treatment options. They are very limited. A lot of them mess with your fertility or they mess with your hormones. And so that's the problem. Like, and I do, sadly, just like this moment with COVID, the more that we call something a Black thing, this gets less research dollars. It gets less input for fixing and
you think
curing
that's
it.
why
So
they
like,
came out with a cure yet? Because they
I'm
were
just
like,
trying
it's
to tell
80%
you.
of Black people. Keep
I'm
it going. I didn't say that on the line. Keep it going.
Yeah, and and truthfully, women in general, like women's health in general, is totally underfunded and not researched. Like, I used to have this big thing around the guy who created the Pap smear. Why do we keep doing that? Is that the most
Why
effective?
does it hurt so much? Why
Right,
do
all
people
of
say
that,
just
right?
a
Like
pinch?
none of us would have come up with it. And that speculum that he uses is the same guy who traveled around the country with the Black women who were enslaved. Like they all created these metal contraption things. And we don't do research to say, how do we then not do harm when we're taking care of women? So there's a woman that I know who studies menstrual blood. You said period. We don't talk about periods, right? But there's so many things you could just get from a tampon that you wouldn't need to actually put a speculum.
I'm triggered by this entire conversation. Toxic shock syndrome much? I had it and everyone's like, she's got AIDS. Like, because no one has it. Like, you know what I'm saying? Like no one has left a tampon or in my case, it was, I had what do you call that? The biopsy. There was a conversation as to whether or not I had abnormal cells. And so they did a biopsy to see what was happening. And they left the gauze inside of my vaginal canal, right?
You have not had good experiences.
No, you know why? Because Black and fat. They don't want to listen to fat people.
Our number one
about being like
bias.
informed. Like it's never there. I'm not saying you. I'm just saying doctors in general, when you are fat, they automatically assume that you are not in control of your health.
Yeah. In fact, it's the number one bias. So obesity is the number one like bias.
I can't believe we're talking about it. Cheers to you, ma'am.
It is. And it's so bad. Like I love to try to challenge my colleagues around. So when you tell a Black woman that she should lose weight prior to doing things. Like if you say, I want you to plan your pregnancy, you should lose weight prior to becoming pregnant. You base that upon her ability to lose weight? Clearly not, because that's a whole, we have no capacity for like this magical, I would just magically get skinny so I can get pregnant. Like,
right.
Where is this going to happen?
As if large women have not been producing for
centuries. All of that. So it comes with all of these like judgments around like, and then when we pull the data out, right? Like, so that's why I love challenging people. Like Black women who are normal weight are still more likely to die in childbirth than white women who are obese.
Right.
So I love bringing this up over and over.
I know some big white women who got several children. I'm like, how? And I dealt with infertility for 8 years. And so I weigh 20 pounds less than you.
Right. So there's this whole thing, like if being skinny was going to save us, why is that not the thing that saves white women? Because they can be poor, they can be uneducated, they can be overweight, and they still have babies that are healthy. So that's the way we've been able to really counter this narrative that it's something we're doing, that's something that we're broken, that if all Black women in the United States magically became skinny tomorrow and you were still treated racist, we would all still be dying. So that it's not on us to just magically get skinny. And the assumption that white women are skinny, I every time somebody says this, I'm like, do y'all know white women? They eat Popeyes too.
I know 5 Black men who are dating big booty Judies and they all white. They're Juliettes, okay?
They eat some Popeyes, they socialize when they're not supposed to, they do all the things that they keep blaming Black women doing, but they do all that.
Brandy said that BMI is anti-Black.
It is. It is. And everything, I am considered overweight to obese most times when I go to the doctor.
You got some junk in your trunk, Joia. I'm like,
well, this is what it's going to be. This is what it's going to be. I'm big boned. It runs in my family.
I ate these beans, you know what I'm saying?
Exactly.
I was having so much fun. I want to talk, Sherry Amore had asked about the IUD, and I'm also interested in this conversation because #newly implanted.
Okay.
Just got the Mirena because I'm not trying to have no more Egypts for at least
But
5 years.
cute. You did such a good job.
Didn't I? I swirled to the left for that baby. You understand what I'm saying? I just yes, Egypt is amazing. And also being a single parent now, which I didn't presume that I was gonna be. Yeah. Egypt is a lot of work to handle on my own. So I'm actually grateful that Egypt is with my grandmother and my aunt and my cousin right now, because I'm working full time and I really don't know how I would have the time to do this, that, and Egypt. Like, you know what I'm saying? So it's actually a blessing in disguise a little bit, you know? Mm-hmm. Let's talk to IUD. Like, why is it, and I know this is not everyone's experience because a lot of people can't do hormones, but when I had the Paragard, I had a very difficult time with insertion. Yeah. So much so that I had another procedure for pancreatitis and I got it implanted while I was under for that, you know. Then they told me it was because I never had children before. And then I had a child, and then the IUD insertion was like having 10 contractions at one time. And so like, what is it about pH balance? You know, the things that the doctors don't tell you. Right. And that we have to go and search in Google search forums and like health.net about pH balance changing. Sometimes I feel like I got a lot of vaginal discharge. Yeah. A lot of people might be like, you got that wet. I'm like, I'm uncomfortable. You know what I'm saying? I'm so dead right now. I can't believe you said you got that wet. I'm so uncomfortable. Why do I have to keep changing my underwear? Like, you know what I'm saying? Like, we have no conversations today. No. I'm just laughing because I'm thinking one day you're going to wish, you're going to be like, where is because we're going to go through menopause, right? Exactly. I hate it here. So I'm trying to hold on to the wet. I'm just saying. Because I know when it's going. I'm doing a praise dance right now, but I'm wearing a romper and it goes up my booty. I'm not going to get up. So, okay. Yeah. Let's talk about IUD. IUD. So I had them, gave them, loved them, amazing. You don't have to think about them. Yes, but your cervix. So when your cervix inside of your vagina holds the baby in when you're pregnant, it's where we do pap smears. It feels like the end of your nose. The consistency of a cervix is like feeling the end of like this. Like this. Okay. And in the middle of it, there's a little hole that when you go through it, that's how you get to your uterus. So that's how sperm goes in for you to get pregnant, but it's also where we put through to get to for an IUD to go in. Okay. So before you had children or before you had Egypt, it was that hole was closed for real. Like we know most people when it was closed for real. That shit, he was like. Right. And in general, people after they have a child, that hole is a little bit more open, and so we can. Oh, so I'm just out here leaking? No. It's but it's more like you mentioned the pain difference. So everybody's pain is different. Mm-hmm. And we have been taught that your cervix doesn't have pain cells. Now think about that. Why would that be the thing that we say? Because men love to beat it up. That's all I know. That's all I know. So for the studs I've been with, I didn't even have I'm to, like, why are you like this? It doesn't have to hurt this much. So I didn't even have to prep you. We have not had a previous conversation. We've not had a previous conversation, but you're saying that medically speaking, the terminology and the knowledge that people portray around the cervix that doesn't have nerve endings, because it's really for the pleasure of men to go as deep as they can. It makes no logical sense that it has no nerve endings. Like that makes no sense. And so when we tell people you can come in and get a biopsy or you can get something placed in your uterus and it will not have pain, that makes no sense. Like it only makes sense in the sense of patriarchy and misogyny. Like there's Thank you for saying it, that there's sexism in medicine. Yes. Patriarchy and misogyny. Yeah. So that's where we are. So I don't know what we need to do to try to, I do know what we need to do. We need to not have so many misogynist, patriarchal people in medicine, but inside of our vaginas. Right. Yeah, but so they didn't, we tell patients you can come in and get this done and there'll be no pain. And consistently, people's pain is very different. Yes, some people can tolerate. I feel like y'all not be telling the truth about actual things sometimes. Like y'all just be like, it's a simple procedure you could just come in for. And I was so mad I want to punch this girl in the face.
I know. And then we really, so I have to, for me, like there are things that I thought, I mean, I was trained like, oh, we do these biopsies all the time. And then once you do enough times, you realize, oh no, this is hurting some people. Like this idea that this is pain-free this is clearly not. There are some people who you do it and they don't even flinch. And there are other people who clearly there's not psychosomatic, like they feel it when you do it and they feel that it hurts really badly.
Right. They're not just like, ooh, wow. Exactly. You're like, no, this really, I'm about to flip a table.
Right, exactly.
Right.
We haven't done enough to figure that out. Like, what do we need to do to figure out who's gonna really hurt? How do we protect them? How do we make sure they're okay? How do we prepare for that? None of that's been researched or done that I know of. It might be, but I'm not aware of it.
So then the other question is, it's not a question that anyone has asked. This is all about my personal vagina health. So so for the longest time, doctors were like, you don't seem to be taking well to the birth control pill. And I felt like a lot of women of color, especially Black women that I know in my family, was like, oh, I hate the pill. You know, you got to remember it every single time. And then, you know, there's the accidents if you don't take it on time every single time. And the white women are like, I really enjoy the pill because like white supremacy has lent me the time to like set my alarm clock, do my yoga, pop my pill, have my green smoothie, right? And so I think about all the forced birth control I've been on, and Depo-Provera was one of them. I gained entirely way too much weight on Depo. You too, and I have, you know, I have comorbidities, which are the things that like asthma, I have a heart problem, like, you know what I'm saying? So things that would already cause me to be in a protected group of like things, right? I wonder why it is. Is it because of racism? Because white women take Depo-Provera.
I have a whole training around this. Look, see, and you haven't even been. You could do the trainings.
Personal experience.
Yeah, so we have data that supports that Black women want birth control that they can control themselves, that's easily reversible, that's not inside of them, that they mostly only use when they have sex. So that sounds like a condom, right? Like it sounds like what
it sounds like they should be pushing condom work,
right?
Slight work,
right? So in the main, it sounds like that's what Black women prefer. The problem is the condom is like 70 to 80% effective, right? So if you are white supremacy,
70% effective.
Right.
We're gonna get into STIs in a moment. Go ahead.
Here we are, yeah. So if you're white supremacy, you're like, I need these Black people to be on the most effective method. I don't really care that they don't want something inside of them. I don't really care that they don't like side effects and they want something that they can quickly, they don't want something that's in their system all the time.
Right.
The pill is something that's only in your system for a day. So if you don't like it, the next day you just stop taking it. Versus the Depo, which you and I were on, or the IUD, it's a long-term thing inside of your body. And we just in general don't like that. When you ask us, Black women don't like it, but we keep getting pushed it. We're overrepresented in getting our tubes tied and in having long-term contraception. So then doctors act as if patients make their own decisions. But when you look at the data, if all the white women are taking birth control pills and all the Black women are getting their tubes tied and IUDs, we just all running around saying we want tubes tied and IUDs. No, sir.
Why are all the white women sitting together? I don't care about them. Let's talk about it. So you're saying, from what I hear you say, or like as Brene Brown would say, the story I'm telling myself about what I'm hearing is that we're really being this is continued sterilization of sorts, because I was told that after I got off Depo that I would be able to procreate if I so chose to within 18 months.
Right.
After being on Depo-Provera for 7 years, I got on it when I was 16 because they told me that's the perfect thing for you. Just come and get your shot 4 times a year. That's how they posited it.
Right.
When I was losing hair, and I gained 89 pounds, you know, and I was talking to
that was mean. I was cussing everybody out.
Do you know what it's like to be on Depo and have mental health issues? And people are like, why is she such an asshole? I don't know. You know, why is it that we're pushed to do things? Like when you talked about hysterectomy, I think about in the comments, there is someone, Adora, she lives in, I want to say Chicago, but I really know it's Canada. So I'm going to be honest and say it's Canada. I just don't know what part. She lives in Canada and she's like, I really don't have a doctor right now because COVID. And she just had a hysterectomy right before we were all put on lockdown. And she's like, at what point is it okay to have sex? Like after you have a hysterectomy, like, why are we so afraid to do the things? Case in point, right out, I would have had another Egypt if I let this dude slide week 3 right after. And they say, wait 6 weeks, you know what I'm saying? But during a hysterectomy, and I think that because they think that you don't really need to do nothing with your factory afterwards, right? They're not really giving out a lot of literature. So what do you say to women who are like, my sex organs are still here and we want to work them? Like, you know, what does that look like?
Yeah. So if you normally 6 weeks is the magical time that we say for most things. So after hysterectomy, we ask that you wait 6 weeks.
Crack on to 6 weeks.
It's like our little standard answer. You know,
after an abortion, 6 weeks, you know,
after you have a baby, it's 6 weeks. We love some 6 weeks. It's a 6 week thing. Well, I mean, the truth is, I have seen people's vagina, you know, I've done hysterectomies, I've examined people across, and
so this is what you do as an OBGYN. So that's obstetrics and gynecology. So you're here about the babies, and you're also here about women's health through this kind of organ, right? So, okay, go ahead.
Yeah. So I've done, you know, lots of hysterectomies, and I've seen inside. So what we're worried about is when we remove your uterus, you have what we call a cuff or a blind-ended pouch. So we take the uterus out, and your vagina becomes like a cup that just really doesn't, so it needs to heal. The end of it needs to heal. So we believe that around 6 weeks it's fully healed, and you don't have to worry about rupture from having penetration from sex.
You hear that, Adora? You better get some. You understand what I'm saying?
If it's been 6 weeks, go ahead, go for it.
People don't let it hit the cervix.
Now, if I were to have a hysterectomy, I would have what's called a supracervical hysterectomy. I would leave my cervix in and just remove the uterus. So if anybody's debating about that,
that's a good thing. What did you call it one more time so we can?
Supracervical, so above the cervix. Leave your cervix and your vagina. Then the whole thing.
Don't let these doctors chop and screw you. You understand what I'm saying?
Leave your cervix. They will try to take your cervix because they're gonna say Black women get cervical cancer. I ain't got it yet. I would like my cervix because it keeps all the alignment of the current position of your vagina.
Okay. All right.
Yeah.
So we talked about, she said the flirting continues. My cervix is gone and I have my ovaries.
Yes.
So we talked about a lot about like folks that have ovaries, uteruses, you know, like that are able to get these things. But I think about trans folks and genderqueer folks, right, that may come into your office. What is the best way for them, you know, because you said you code switch and you know how to do it, right? What is the best way for trans folks to come into an office with someone who is providing sexual health care services for them and say, you know what, you keep gendering like this, and I need to talk about it from my perspective because this is my lived experience.
Yeah, and you know, for a while in New Orleans, I was at a clinic that had a large volume of gender nonconforming folks, so including transgender, and really it's finding a place that you feel safe. So it's hard, you can't just go to anybody with that conversation. Let's just start off top with that. Like, we're not all able to, none of us are really trained around it. So that's a really important thing to know. That
so there's no medical training there. Y'all might have Jane Marie Hill and I, we spoke at the Harvard Physicians. I don't know, y'all doctors be having conferences and shit, and we just showed up.
Conferences. We do.
Y'all love y'all conferences. Y'all got some good food at the conference.
We do. Don't let it be Physician Day. Physician Day, we get all the filet mignon. Dr. Day just
we were like at the Fairmont Copley. I was like, they done put niggas up. I was like, okay, I see you out here. And I did ask Dr. Michelle M. Morris, so we'll see what happens. But I remember Jane Marie and I were doing this conversation where we were talking about case studies. And we did it so well that Jane Marie was able to talk about their experience in the medical profession field as someone who is gender nonconforming, and just like, I want to talk about my bodily organs in a way that like you can identify with me. And I appreciate you saying that conversation is not going to be safe with everybody. But what does it look like who do we reach out to?
Yeah, man. And I would count on, just like Black people do, we count on what our friends tell truthfully, like our community. So there must be people who in the trans community, wherever you are, that other people have gone to see that have been good, right? Like the word of mouth is really, really real. Someone who actually listened to you, valued you, paid attention to your symptoms. That's not something you're gonna be able to Google and find on someone's website. Very rare. There might be a few doctors across the country or a few practitioners who advertise that or say it, but blatantly, really the community in most places knows where they can go and they're treated well and where they're valued and where they feel safe. And it's not going to be, sadly, a lot of options. We are still learning in healthcare how to work with gender nonconforming trans folk and really what that looks like inside of healthcare. So we're not equipped to handle the needs as an organization. Like healthcare in and of itself is still struggling to figure out what to do. So I would listen to
so Black folks who are gender nonconforming and are trans just got it worse than us. Like
they
you know what I'm saying?
Like, they really do. It's a whole thing. Like I always, to me, that is the most like I worry about if you're in rural America and you are a transgendered man who's pregnant.
Right.
Like what in the world? Like where? Like where do you get
folks are just not trained to understand it? And like how do we advocate for the conversation to begin happening? Because I feel like it happens in major cities maybe, but it's like you said, it doesn't happen in rural America. You know, not trying to think about whiteness, but I think about someone like Matthew Shepard who like middle of the sticks, like, you know what I'm saying? And I always think that there are no Black people in Iowa, but people always prove me wrong. So
yeah, there are. We are everywhere. There's not a place that we aren't.
Yes.
Turns out.
She's like, we turned out.
Turns out, yeah, but yeah, I think yeah, there are places, a lot of places in urban America that is not happening either, but specifically rural America, as a person who's from rural America, loves rural America, like I can't even imagine what that looks like for anybody trying to go to a clinic or a doctor or provider and be and feel welcomed and loved and seen, and like the person's gonna, even if they don't know it, like for me, if you came to me and I'm like, I'm not exactly sure what we need to do today, but we're gonna work through this together.
Right.
Make sure that I do whatever I can to make sure you're healthy. That would be my answer. Because I don't have all the expertise on transgender health, but I would try to figure it out because I would value you as a human being. And so I would want you to have whatever you need.
I love you so much. I hate that you're so far away because I would just sit at your feet at the waters of Lake Minnetonka and just, can I feed you grapes? So there was a question by a Black doula. Why is it that so many young mothers are forced, like right after delivering the placenta, to get the installation of a LARC? And I was like, what is a LARC? You know, like, I don't know what we're talking about. So I have one, but I don't know.
But that's also that. Yeah, that's what that using the word LARC is like Medicare for all. So it's also trying to change the name. So if it comes with a stigma.
We're so ashamed.
So it's like so we don't call it IUD anymore. It's a LARC, and there's a whole class of them. Yeah, we have an article in the New York Times. Because there's a whole thing around like using LARCs to decrease poverty.
Right.
And for 50 years, there's been this belief that if we could only give Black and brown people birth control, like Richard Nixon's war on poverty, his anti-poverty strategy was family planning. So of
course it was.
Of course it was. So he put family planning clinics, he put money into family planning across the United States. So there's still belief that if we could just get these Black and brown people around the globe, right? So this is like a global belief. If they would just stop having babies, then they would be wealthier. There's a lot of broke people, a lot of people with no money who have no children. So there's nothing magical about like not having kids that gives you money. You get money with power and resource and education. And then you decide how many children you want to have. So rich people, our current administration, they can have 8 kids with 3 different women and nobody cares because you got money, right? So this idea,
he got money.
He got money. He got our money. He got our money.
30, I know.
Ain't that some shit? That's the part that makes me mad. Anyway, yes, so it is real that they have been using jails and Medicaid as places to increase LARC enrollment, and organizations like ours and others have been fighting this idea that shows your racism when you do that. Like unless you're trying to push LARC at the colleges. I want you to go to Harvard and BU and say all those people need a LARC. If you're not doing that, if you're not saying as soon as they get out of class, we're gonna line them up and get them LARC.
Have you had an IUD, Caitlin?
Exactly. Exactly. And it hurts Caitlin too. Let me tell you how it hurts Caitlin.
Tell me how it hurts Caitlin.
It's believed that it's only for poor people and people in jail. When Caitlin's 25-year-old self goes to her private doctor and says, I want an IUD, her doctor says, no, that's for poor people and people in jail. And Caitlin fights and she tries to go to 5 different doctors. And if Caitlin would just join our cause to say it's racist, that you only think it should be for poor people and Black people, then she could get the freedom she wants for her IUD at 25.
Right. So essentially what you're saying is that if all lives matter, then you wouldn't be upset if we said Black Lives Matter. Reminder. And I'm saying this to you and I feel comfortable because some Black people don't feel comfortable saying Black Lives Matter.
Oh, you know, I say it every day.
I had a shirt that said Black Maternal Lives Matter, like Black Maternity Matters. And I thought that was dope, that a doctor is.
Look, I wear it when I do trainings. I wear it when I'm doing trainings. And look, it anti-racist.
They get nervous. They're like,
they get real nervous. I had a shirt on that said trust Black women. I got a comment after the training that I had on a Black.
You did.
I got a comment that said I had on a Black Lives Matter shirt. I was like, he couldn't even read. He's a whole physician. He saw trust Black women and made that be Black Lives Matter.
I one time got not kicked out, but they were like kind of concerned. I went to come do a training at a Watertown middle school. I won't say which one. And I had a shirt that said Flint Lives Matter, but it was in the BLM kind of like lettering. Yep. And I bought it from Indigenous people to help with water filtration systems, right? And I went into the school and she was like, you cannot wear propaganda in the school. And I went like this, you have Martin Luther King Jr. on the wall.
Look, I testified in front of Congress.
I want to talk about it because I seen it and I was like.
No, a couple of months ago. And I went there with a Trust Black Women t-shirt on because the 2 people who were running the hearing were Black women. So I was like, this is the perfect time. It was Congresswoman Alma Adams and Congresswoman with the hat. That I can't think of her name.
People that always describe somebody to you. You know what I'm talking about? The lady with the hat.
Wears the hats. They're like cowboy hats. They're like hats. She's good people. Anyway, so they were going to be the leads of this subcommittee hearing. So I was like, oh, and it was all Black women on the hearing. So this was like our thing. So I had on my little Trust Black Women t-shirt and they were like, you can't wear that and testify. So I had to change shirts with my intern. But she sat behind me and she wore the Trust Black Women t-shirt behind me. So it'll be in the screen.
But isn't it funny that the white women can get up there and then they get Vlad videos made about them because they've said the same thing a Black woman said 85 times before that? Listen.
You know, I am encouraging. I want all the white women to say racism every time they open their mouth. I would like for them to really lean into their aunties, their cousins.
You know who said racism today in a very different way? And I was shocked because I cannot stand Andrew Cuomo. I know everybody in New York loves him. He's the new president, right?
I actually have some friends that don't like him either, yeah.
I said, sir, you're using prison labor to make fucking sanitizer. Like, are you kidding me? And you know, he won't approve weed here. It's so much. But anyways, we're not gonna talk about my personal politics. He said something today because I do listen to his little broadcast because I feel like I waste my time with the president of the United States because he just
it's painful. It's hard for me to listen to. When he started blaming the doctors for stealing, nurses for stealing the PPE, I was like, what planet am I on? What?
So there was a meme, I'm gonna share with you real quick. There was a meme that it was like, what face do you make when President Trump is speaking? And it had like John Amos, like, and it was like the dude from Star Trek. You know, it had like so many confused faces. Yeah. Like it was wild.
Yeah.
There's a question. Oh, so let me tell you what he said. He was like, you know, when we talk about the high areas and concentrations of COVID, we're talking about in the public housing areas. So of course it's Black people problem, right? And then he was like, and so, but we have to really think about the structural racism. And I was like, I think I was washing the dishes. I was like, what did he just say?
I'm just telling you, that's a win. Every time they do that, I'm like, yes.
He said people in white communities feel like they don't understand what's happening. I said, did this nigga just say white communities? So I typed it in the comments on his live. I was like, sir, you just said white communities, and I'm here for all of this. And he was talking about how we have like, like these plants, these electronic plants, these these energy plants in our neighborhoods. And I think about where I live. I live right on the orifice of south end of Albany, and there's a huge plant being built. And so of course people are going to feel sicker and have these comorbidities that if someone gets COVID, on top of having diabetes, on top of having asthma or a heart problem, of course they may not make it. It has nothing to do with the Black social responsibility.
Exactly.
Talk about the racism.
So I'm saying that it's a win when you can get governors. Even the guy.
Small win.
But I take all the wins.
I take it all. I got my $5. Come on.
Exactly. Because what we historically up until now, they would have just kept blaming us. If only they would go to the doctor. If only they would not, eat so much Popeyes. If only they wouldn't want to go to church. This whole list. And all of those things are all made up and false. So yes, we know that one of the reasons people die from COVID, not just catch COVID, but actually die from COVID, is your immune response. And you mentioned talking about autoimmune disorders. And so for Black folks, so I think of our immune response. Think of your body. Your immune response is your body's ability to fight off infection, disease, illness. Racism is the biggest infectious disease, illness that and so we're constantly fighting it. So our immune system is always revved up. It's already on high alert. We have higher rates of all these illnesses because we're constantly already fighting a virus called racism. So when the real virus comes, our bodies
are already write that down.
When COVID-19 comes, our immune system is already activated so much that activation from the virus, we die more frequently. And that's just the truth. And we know that to be a truth. So that's why when we keep looking for pills and shots and things for these things that are higher rates in Black people without actually ending racism, because we don't believe, I'll tell you, our elders don't believe that white folks would ever stop being racist. So they tell me, my colleagues who are my elders and my mentors, they're like, you keep talking about racism. I want them to find a shot for this stuff because they ain't gonna never stop being racist. I'm like, but no, they can.
You're like, I want them to be redeemable. And your grandma Marie is like,
they're not gonna do it. She's like, baby, let them keep looking for that shot.
Yo, I gotta give a shout out to our elders. I'm telling you, because even though we struggle with connecting with them, they know what they know.
They know, they really do. And that's a real, so when I fully understood, because I was like, why do we keep letting white people talk about race as if it's genetic and biological? And the reason is because our elders, the equivalent of me, who's 30 years older than me, really didn't see any room for them to stop being racist. She was like, let them keep talking about biology and they'll find some pill, they'll find some shot, they'll still be racist, but at least we will live.
And now our generation is like, we're anti-racist. And they're like, what the fuck is wrong with you?
Exactly. I mean, every time I say it, they all look at me like I'm nuts. They're like, they are not going to be. I can see them shaking their heads at me. They're like, this is not going to happen.
There's a question from the audience. It says, Simone asks, if a doctor does a biopsy, uterine or cervical, and finds, quote, a high count of high estrogen receptor cells, that's some white people shit. Does that mean that there should be more follow-up or a family history? She said, I think she's saying we have a family history of breast cancer.
Okay. So so normally we don't use uterine or cervical biopsies as a means to extrapolate to breast cancer. Like those are two different things. There is a genetic link for breast and ovarian cancer, not cervical. Cervical cancer is in general caused by the human papilloma, HPV, which we get from sex. So it's a cancer caused by having sex, right? But so if
hold on, did you say? I want to understand.
Yep.
Did you just say that it's a sex-causing cancer or a cancer caused by sex?
Cancer caused by sex.
Shut the front door.
I am telling you.
Okay, go ahead.
Yeah. Yes.
Ooh, child.
Yes. So when I was a younger doctor, I would say, so not only to my teenage patients, not only can little boys give you, gonorrhea and chlamydia, they can give you cancer.
Right.
So, it's real. They can.
Wow.
Yeah. It's the whole thing. But yeah, so I would, we don't equate that biopsy to your breast cancer. And you can get a follow-up. It depends on what period of your cycle you're on. If you have estrogen receptors, they change during different parts of the month. And so it's more, usually only checking for that around fertility. Estrogen receptors in your uterus are not something we generally check for, except for fertility reasons.
What is the film about? There are several people in my comment section talking about sliding a piece of film into your vagina as a source of birth control. Yes, what is that about? It's like the conversation was, from what I understand, condoms or film works. And when we talk about natural family planning, you do have people that are trying to use less hormonal stuff in order to prevent pregnancy. So is it working though?
Yeah, so
I know the lady who commented got 4 kids.
Like a female condom. Like a female condom.
Okay. She got 5 kids. I love you. I ain't gonna say your name, but you have 5 kids. Talking about you using the film for contraception. Lord, well, makes sense.
Yes. Yeah.
But no, does it work?
Yes, it does. So we use barriers work. They just don't. So there's a gradient of the least effective to the most effective.
There's a gray area with the film.
Yeah, all of them. So like the least effective method is rhythm and pull out method, right? So you go.
Let me tell you, eat your baby was a pull out baby.
Yes. So pull out is the most frequently used. That's what people pull out in rhythm and none. We don't like having hormones and things like that. So what the industry of health hasn't figured out yet is you're not going to make us suddenly like it. Like it's not.
You're like. Well, first of all, I resent that implication because I enjoy my GMOs extremely well. I need to have my Kraft macaroni and cheese with the red number yellow, no, go ahead.
So they just keep trying to force people to find different ways to give us hormones. And in general, we just don't like having hormones and things in our bodies. So yes, it's going to work to have any kind of physical barrier. It's like right now with COVID. So yes, the N95 mask is the most effective. But a cloth mask is still something we should do. It's okay, right? So it's like that kind of thing.
All right. And then there's a question too. People, I really love this conversation because I feel like people are actually joining in and talking to one another about our experiences. So I feel like we've created a container here.
Yes.
I'm really excited about that.
Yeah.
My next question I want to ask you about is because you talked about a gradient. So the film is maybe what, like 70, 80%? Yeah. Right? Which is lower than condoms, right? Mm-hmm. But what if you're using 2 birth controls? Yep. It's better than 1?
It's better than 1 for sure. You just don't want to use 2 condoms because they rub against each other and they don't work well.
Are you talking about causing a fire inside of my cervical walls?
So people will think, 2 condoms are better than 1. The answer is no, they're not. So just 1 condom, right? But if you had like a condom and on the pill, right? Like you're doubling like the not you're not getting pregnant. But there are other things to use contraception for besides pregnancy.
Let's talk about STIs and STDs because the jury is in. We have some stigmas.
Yes.
And so I'd like to talk about it.
Yes. Yes.
So what is the difference between an STI and an STD?
None. It was just, once again, this language thing again. So we went through this moment of not wanting to call things an illness and saying that when you receive, it's not an illness like chronic hypertension. It's not a long-term thing. It's just a disease that you can treat with medication. So it's semantics. So now I'm on meetings where they go back and forth between both words.
That's like, to me, if I could understand it, in like layman's terms, that's like the time that I broke my foot and they called it a hairline fracture. Oh, it's just a fracture.
Right.
But I was like, it's still broke. You know what I'm saying? Yeah. So the words you're saying the word STI, meaning sexually transmitted infection, same as the word STD, which is sexually transmitted disease.
Yes.
So can we go through them?
Okay.
I've never been this excited in my life. Well, a lot of women I know work for Planned Parenthood.
Yes.
Right. And they're always like, we're advocate, like it's like a Frederick Douglass song. Agitating. We're advocating. Yeah. But when we talk about the most marginalized folks, I think about conversations that happen in our community. And I'm going to talk about 2 in particular. three in particular. Let's make this a small 3-part series.
Okay.
A lot of people don't like going to the doctor because of medical experimentation. As you know, you're a doctor. You know about Tuskegee, you know about syphilis, you know about sterilization of Black women and Indigenous women. You know about these things, right? And so people don't go to the doctor. But people have become hood doctors, which is not a bad thing. It's not a bad thing. I do believe in homeopathy. I think that homeopathy was largely responsible for saving actually a lot more Black lives, because it was homeopaths that were saying, don't take hydrochloroquine, hydrochloroquine, like, you know what I'm saying? They're trying to kill you. Right. You know what I'm saying? And then CNN was like, they're trying to kill you. Right. You know? So I think about STIs, STDs, that is interchangeable, but I think about the top STI or STDs that people can be afflicted with. So I think about terms like the clap. I think about HPV, because everyone has told me it's a kissing disease, right? I've heard about AIDS. I sometimes know what the difference is between AIDS and HIV, but something that we don't talk about is chlamydia, because it's curable. Oh, he burned me. You know, you hear all these songs like "Don't get burned" and this, that, and that, or whatever, right? Or she burned me because, you know, she was messing with whoever is burning whomever, right? I think about chlamydia, and I think about herpes, and I think about the stigma around herpes between herpes, the HSV, like the herpes simplex. I'm trying to use correct terms, because
I see you. I see you.
You see me out here?
I see you.
I'm trying to get to what block you real quick. Like, oh, you don't know what you're talking about. No, we don't talk about it. So can we start with chlamydia?
Okay.
What is that about?
Okay. So chlamydia and the clap. So gonorrhea and chlamydia are both curable with antibiotics. Okay. And syphilis. So all three.
And syphilis. So you got three fucking STI, STDs interchangeable. Chlamydia, gonorrhea, and syphilis that are treatable.
They're treatable with just antibiotics, that you take antibiotics and they go away. Chlamydia, the reason why it's hard is you don't really have symptoms. And so people have chlamydia and they might have, they're more wet, as you said earlier, right? But it's
chlamydia, I just wet because this IUD done changed my pH balance to 13.
But whereas when you have gonorrhea, it smells like rotten eggs. And so people usually know when they have gonorrhea, so they don't have it for a long time. But
because they're like, let me go to the doctor real quick and get this taken care of.
Eggs. I need to get this taken care of. When you get medicine.
You tell people that using Monistat 7 will not clear gonorrhea.
Monistat 7 won't clear anything except for a yeast infection. That is all it will do. And we were nervous. I remember, so I'm old enough to remember when you couldn't treat yeast infections over the counter because we were nervous that people would have gonorrhea, chlamydia, and other things and keep trying to use over the counter medicine. So you had to come in to be evaluated to see what's the difference. So the good news is now we've had like 20 years of people being able to treat it over the counter and nothing has happened. Like nobody's dying.
No one's like an uptick of gonorrhea clad patient.
So the fears that the medical profession had, which leads to this current conversation around having birth control pills over the counter, like our need to control things is a lot of times the barrier for people being able to be free. So we can get antibiotics.
Talk about freedom?
Freedom. I'm here for freedom.
I see why your ass get in trouble.
I stay in trouble. But herpes you cannot cure, and HPV you cannot cure. They're both viruses like the coronavirus. And they are
and you can't currently cure the coronavirus. You know what's funny? I was thinking about I'm isolated here. I think we're not social distanced on Saturdays. My friends do come to visit me because they know I'm all alone by myself in this house. And they're like, we promise, Girl Scouts honor, we've been social distancing. But I've been thinking about the interconnectedness between the stigma of having coronavirus. If anybody coughs, everybody's trying to look at them like you're diseased. So, you know what I'm saying? But essentially, it might be true. I'm just going to put it out there that all of us are going to contract it because we're not, it's May 15th isn't the cutoff date for coronavirus to end. You know what I'm saying? So what does it look like when we have something like HSV1 and HSV2, which there's a stigma around those two things. Some people that have HSV1, which is herpes here of the mouth or on the face or whatever, feel like they're not the same people
right.
as the people that have HSV2, which
and that was honestly an easier conversation to have up until we increased the numbers of folks that have oral sex. So now this kind of delineation between HSV1 and HSV2 is really blended and gone, because when you have oral sex, you will find HSV1 on your genital area. So this separation between mouth and genital has now collapsed. So it's just herpes.
The empire strikes back.
It does. So if you have a fever blister and you you get fever blisters and you perform oral sex on someone, that person will start having outbreaks on their genital area. That your genital area doesn't care.
So it doesn't matter anymore. HSV1. So the whole thing about Usher, right? Let's talk about Black people shit. Okay, the whole thing about Usher, first of all, trash, because man, right? But what was it, do you think, like you as a medical professional, the response between folks who are like, oh, he gave her herpes, right?
Right.
And it didn't come from, like, is it a non-educated thing? Like,
I just think that
I'm not saying that we're not educated, but like, what is the disconnect? Mm-hmm. Because everybody is going to know somebody with coronavirus, just like everyone is going to know someone with herpes, or like you said, it's HPV, which is human papillomavirus, right? So these are viruses. Mm-hmm. So if we're all going to know somebody with one of these things, how do we break a stigma?
Right.
And what is medical professional? Look at me. I'm pointing. What is the medical professional's responsibility in helping to educate the patient as to what is happening?
Right. I mean, I have friends and patients who were devastated. Their lives totally changed when they found out they had HSV, right? It is that I know how big of a stigma, the belief around what people decided it meant, which it doesn't mean, right? So this idea that certain things, like even talking about Usher, separating one versus two, like all these are Ursha. All those are just attempts at trying to make something that's a normal. People have sex, and in the exchange, when you have sex, you might get STDs, STIs, and none of them are better than the other. So it's not like, oh, if I had gonorrhea, that made me a better human being than if a person had nothing, or if they had herpes or HPV. Like having moral judgments around viruses and bacteria is odd, and it's
odd.
It has its roots in all these like religiosity, misogyny, patriarchy. Like this, we should all have
clean. Got a doctor. Can you be my doctor forever?
Right. So I have no moral, like our role is to say that a virus and a bacteria is not a moral judgment. Like there's not, and we can't have a hierarchy of which disease is better or worse, or which disease means you're a better person or a worse person. Even to the point of the HSV1 too. Like I do think people use this idea that it was only one in fever blisters to make themselves feel better around if they had HSV. But truthfully, you can get any one either place. People have HSV on their hip. They'll get blisters on their hip, they get blisters on the behind. Like it's a virus. So you just, wherever your skin comes in contact with the virus, you will have outbreaks.
Right.
So it's not the moral, it's not church, it's just a virus.
It's not church, it's just a virus. When someone has HPV, right? Is it a kissing disease?
No, it is not a kissing disease.
It's not mono.
It's not mono. I think what that means is easy to catch. So it's really it's easy to catch. So if someone performs oral sex and someone who has HPV,
I gotta send a memo to my husband. Can you perform the oral sex, sir? Thank
you. So people get throat cancer from HPV.
Oh, wow.
Yeah. So
don't tell the Hoteps that, Dr. Joia Crear-Perry. You can't tell the Hoteps they're going to get throat cancer.
They can get female cancer and they can get throat cancer. They can get both from HPV.
Mm-hmm. Wow. Okay. Yeah. Thank you for educating us.
Yeah. I should probably take my behind to bed at some point, my dear.
I just want to say thank you. This has been amazing. And
I know. I was like, I can't believe it's already 9 o'clock. What am I doing?
Who makes the time here? I just want to say, I have a question that I ask all my guests. I'm going to let you go. But I have a question that I ask all my guests. It's two-pronged. Okay. The question is there anything that I didn't ask you that you were surprised I didn't ask you, or you felt that something was missing from the conversation? And two, who would you want to see on the show?
I'm not surprised. You asked me all kind of stuff, so I'm not. There's nothing. It was exactly what I expected it to be.
You're like, that damn Didi Delgado.
I was like, I'm ready for this. Yes. So I don't know. I don't really. There's so many people. I mean, I think the truth is having someone who's comfortable enough to be honest and just to have a conversation. So that's really the kicker. There are a lot of people who can provide information, but just being comfortable enough to just be honest.
All right, we're gonna look for honest people. Dr. Joia Crear-Perry, we've listed your Venmo. If you feel like you've gained something and you ain't got it, tag a white person to donate it on behalf of you, okay?
I appreciate that.
I really appreciate the time that you've spent with us. It has been so meaningful to me. I did not realize it was 9 o'clock either.
Right.
Thank you for appearing on the full set. And I hope that y'all have a good night and you take care of one another.
Thank you for having me. Thank you.